Namaste. Today topic is IV fluid. So let us discuss on IV fluids. What is IV fluids? IV fluids are liquids injected into a person vein through an IV intravenous tube. They prevent artery dehydration and electrolyte imbalance. So when patient is having a dehydration or electrolyte imbalance, we used to induce a liquid form of fluids into the patient body through an intravenous cannula. So in this type we'll induce a fluid into the patient body to make a corrections. So in these IV fluids we could see there are main two types of fluids. So what are all the two types of fluids? There are crystalloid solution and colloids. So what is crystalloid solution? These are the most common types of IV fluids. So in the sense, on daily basis what we used to give it to the patient like a sodium, dextrose, all those things comes under crystalloid solution. So these solution contain small dissolved molecules that pass easily from the bloodstream into tissues and cells. Example, normal saline, which is salt in water, and dextrose water, which is dextrose in the sense sugar in water. Another example is lactate ringers, which contain sodium, chloride, potassium, calcium, and lactate. It's used for aggressive fluid replacement. So in a crystalloid we could see sodium, dextrose and ringer lactate, in the sense all electrolytes. So these are all the fluids comes under crystalloid solution. And in a colloids, these are large molecules that cannot easily pass through cell membrane and are more likely to stay in the blood vessels. Example, albumin and starch. So these are all comes under colloids. So let us discuss what are all the crystalloid solution. In a crystalloid we could see sodium, ringer lactate and dextrose. Usually this sodium will be given to make a corrections like when patient is in a shock and during resuscitation. So aggressive replacement will be done to reverse the shock, and during resuscitation also will induce a sodium to the patient body. And when patient had a fluid challenges, metabolic alkalosis, blood transfusion and hyponatremia, and when patient had a DKA, during this time we used to use a normal saline to the patient. And whenever you are using, be caution with, if a patient is having already heart failure and patient is having a edema all over the body, and if patient having a hypernatremia, please don't induce any kind of sodium to the patient. Again it will cause fluid overload. Next is ringer lactate. So when we will give a ringer lactate for the patient? When patient is having a dehydration, burns, GI tract fluid loss, acute blood loss and hypovolemia. And this ringer lactate contain, I already told, it contain all electrolytes. So whenever you are inducing a ringer lactate, be caution with renal patients because it will cause hyperkalemia. So if a doctor advised, then only you need to follow the orders. And patients with liver disease cannot metabolize lactate. So in that case what will happen? Lactate is converted into the bicarb by liver. So here also be cautious with the usage of ringer lactate. And next is dextrose. So dextrose will be used whenever patient had a dehydration or when patient require a dextrose to the body, and also when patient is in hypernatremia. To correct a hypernatremia we used to induce a dextrose, and this solution will become a hypotonic when metabolized. Do not use for resuscitation. Use cautiously in renal patient. So whenever we are using a dextrose, again we should have a cautious. As per the doctor advice only, we have to follow the order. Here you can see the IV fluid. These are all crystalloid IV fluids, very commonly used IV fluids, and these are all colloids. So albumin and starch. So these are all comes under colloids. And here you can see normal saline. This is NS. It contains sodium chloride 0.9%. So this NS comes 100 ml, 500 ml, 1000 ml and 3000 ml volume of a fluids we can get. Okay, in NS there are different type volume of fluids we can get, and this is half NS. So this half NS contain sodium chloride 0.45%. So half NS contains sodium chloride 0.45%. And here you can see dextrose bottles. So this is DNS. So this DNS contains sodium chloride 0.9% and 5% of dextrose in a DNS bottle, and it comes 500 ml. And again this is a 5% dextrose. It contains dextrose of 5%. Okay, so and here you can see the dextrose 10%. So this dextrose 10% contain, it is a 10% of dextrose in this bottle. And here you can see the 25% dextrose. So it comes 100 ml volume and it contain 25% dextrose in the bottle. And here you can see this is a half NS bottle. This half NS bottle contain sodium chloride 0.45% and dextrose 5%. It comes under 500 ml volume bottle. And RL. So this is 500 ml volume, and again it contains compound sodium lactate injection and ringal lactate solution. So this comes sodium lactate, sodium chloride, potassium chloride, calcium chloride. So these many electrolytes will be there in a RL bottle. And here this is isolate P bottle, will be used for the pediatric cases. It has multiple electrolytes in this bottle. Comes 500 ml volume, and it has many of the electrolytes like sodium, potassium, magnesium, dextrose and sodium chloride, all those things this isolate P contain. Okay, and these two are colloids, albumin. This is a albumin bottle, 20 gram per 100 ml, and this is a starch. So these are all comes under colloids. So these are all the IV fluids type.